Hi, I'm Cayetano Santos. Today I'm going to talk a little bit about my story. Back in 2000, I was on a car accident coming from work, going home. Based on the records, shows that I was deceased at the time, but in the process of people cutting the car, they found out that I still have some pulse and I was life-flighted to HSU, where I needed to have my leg and my elbow repaired. In the process, they also found that there was some problems with my heart. I couldn't breathe, and they found out that there were some holes in it. And we always think that this was a miracle that the accident happened, because I would have died at the age of, doctor said, 25, 32. I recovered from that surgery, and then in 2005, I was having fever of 105 degrees, and I went back to the hospital, and they found out that the valve that they replaced with a homograph back in 2000, it got infected again. So they needed to reoperate on me and replace the valve again. After that, I went on with my life. Everything was going great. And then 2017 came, where I was driving, and I was just falling asleep behind the wheel. And kind of concerned me, but because I didn't have insurance and I didn't know what to do, and I didn't want to go through that again, I kind of hesitated a little bit to go to the doctor. When I finally went to the doctor, they told me that I only had a few months to live, and they needed to reoperate me again, but this time was with a mechanical valve. After they told me the news, I went back home trying to think, but I couldn't think much. So, and I ended up having the third open heart surgery, and I needed to have some help. I didn't have the resources to pay for what I needed to go through, and that's when I got the help from Salem Health, Project Access Network, and Oregon Heart Center. To me, this is a blessing, knowing that there are people out there that really care about human life. And I want to thank you all. Thank you very much for everything. Thank you from the bottom of my heart. Thank you.
Hi, I'm Priya Kansal. I'm one of the cardiologists with Northwest Permanente, and I practice in the Salem area. I volunteer as the medical director for Project Access Network to recruit Salem area providers to donate their time and effort towards taking care of low-income, uninsured patients who otherwise would not have access to specialty care. I truly believe that healthcare should be available to all without their assessment of their ability to pay. Believe it or not, even with the Affordable Care Act, there are still over 31,000 people in Marion and Polk counties who are uninsured. Many people still don't have access to medical services in our community, especially specialty medical care. People like Tano are left with literally no options if they are struggling to make ends meet financially. The work of providing health to all, Salud para Todos, is work that we can only do together. We can give patients a chance to live healthy lives. We currently have over 100 doctors represented within the network, but we need more. If you're a provider for Project Access Network, thank you for your support for these patients. If you haven't joined yet or wonder how you can help with the effort, reach out to our program staff. We would love to connect you with this important mission.